businesses, and today I'm going to talk about OSHA and COVID. So I'm going to share my screen with you all, and I'm going to try to get through the whole slideshow, but I don't know if I'll be able to. So if I'm not able to, I'll send it over to Hal and Jared, and they can make sure the attendees get it to you. All right, so I thought this one was funny because I feel like this is kind of how I feel every day when I go out, right? I saw another, as HR, what are we going to do if the coronavirus impacts our company? So, I saw another video where, someone at the door bringing someone in accidentally sprayed the person in the face with sanitizer instead of checking their temperature. So, I think we're all kind of trying to figure out and navigate this new world, right? So as a disclaimer, I'm not an attorney. I do not provide legal advice. This is information provided based on, my experience and various education that I've had, right? So everyone knows OSHA. They're a little bit more stringent in certain states. Georgia is not one of those states. However, all companies have to comply with the general duty cause, which means you have to keep your employees free from hazards in the workplace so that they don't get hurt, right? Everyone has to comply with that. So how does this relate to COVID? Well, COVID is an illness, right? And it can be transferred in the workplace as well as many other areas. And so what OSHA has done is they've issued out guidance for employers for preparing the workplace for COVID. And part of this includes this triangle that kind of, tells you which jobs they say are very high risk, medium risk, and low risk. So obviously, healthcare workers, morgue workers are very high risk. High risk are healthcare support, delivery, mortuary, and medical transport. Then we get into the medium risk, which would be people that have frequent contact with the public. So this would be retail, schools, or other high population environments. And then low risk is minimal contact with the public. So on each of these steps, the employer has a responsibility to conduct a hazard assessment for each task that is being done. This is how you determine which risk your employees are at. So are we low risk, medium? And it's not just your company as a whole, but you've got to look at each job. So maybe, whoever, someone sitting in an office by themselves, they're probably low risk. But then maybe in the same company, you've got someone that's going into homes, installing, right? They might be at a medium risk or a high risk, depending on the situation, right? So you have to look at each job, each task, and then determine where they fall on the risk pyramid. So once you've identified that, then, the OSHA says there's 3 different things that you need to do. You need to look at your engineering controls first. So can you engineer out the hazard? That would be the best option, right? Because if we can engineer it out, then we don't have that hazard anymore. Some things that we can do are, with relation to COVID in particular, are appropriate ventilation, routine use of disinfectant, barriers, partitions, ropes to separate employees or the public, drive-through style partitions, windows, hands-free trash receptacles, other hands-free things. So we've seen some of these being done, right, in our daily interactions with businesses, with the public. We've seen some of these things be done. If you can't engineer it out, then you want to have some administrative control. So this is where we've got the social distancing requirements, the occupancy requirements, floor markings, cough and sneeze etiquette procedures. So this is, includes training employees, right? And training people that may come into your building. Procedures for how frequently what chemicals we're going to use to disinfect, signage, employee health monitoring. So there's, apps that you can get that you can have employees log in every day and say, check my temperature, I have not had a fever, I have not, and then it gets sent to your company so they know, okay, you're good to come into work today. Employee training is so important. Modified interactions or screening procedures and shift change procedures. So these are things like rotating the shifts. So you have half of your people come in Monday, Wednesday, Friday, the other ones come in Tuesday, Thursday. So these are some things that we're seeing with larger companies where they need people to come in, but they also need to make sure they're not putting their employees in a situation where they're going to be at risk, right? If you can't engineer it out and there is no administrative control, then the next option, and this is generally the last thing that we want, is PPE. Now we're seeing this happen a lot, right? Because we can't engineer it out and we can't control it administratively 100%. So because of that, we have the PPE. Especially for those very high risk and high risk work environments, and then also, the locations where you're frequenting people. So one thing to keep in mind is if there's a face mask requirement, you need to consider the OSHA respirator program. I'm not saying you have to comply with that, but it needs to be looked at, because if you're requiring face masks, there are some requirements under the OSHA respirator program. An N95 mask is considered a respirator under OSHA. And so if you're requiring that, there's fit testing that has to be done. There's training that has to, so there's things that have to be done. So it's not just as easy as saying, all right, everybody is required to wear an N95 mask now. One thing OSHA says that you need to do is every company needs to establish a safety and health program. This is going to reduce your number of injuries and illnesses in the workplace, and hopefully the severity if you do have injuries in the workplace, which can, reduce the cost. It can reduce your work comp premium. It can reduce costs on downtime. And so you have to train employees though, and you have to enforce it. So that's the hardest thing, is the enforcement. People want to have the program in place, but they don't want to enforce it, right? What OSHA says we need to do for COVID is have a written COVID-19 exposure control plan. This plan outlines how workplace will keep workers safe and prevent the spread of COVID in the workplace. And so your plan needs to be specific to your workplace. And there's no size. This is just a workplace needs to have this. And it could be a one-page document. It doesn't have to be this long drawn-out document. It could be a 1 or 2 page document, but it needs to be specific to your workplace. It needs to identify all areas and job tasks with potential exposures and include control measures to eliminate or reduce. So you could say, we've got, oh yeah, go ahead.
Sorry, I just got something. I gotta go.
Oh, bye.
Sorry, bye.
So it can just be as simple as, we're requiring employees to wear masks. We've provided employees masks. We have disinfectant and sanitizer available for all employees, and we're cleaning areas every day or multiple times a day. I mean, it can be as simple as that, right? It doesn't have to be this drawn out thing. And don't forget to issue it to employees and train them. So here's where we get to, is COVID-19 work-related? This is a question that I've had a lot of my clients ask, and this is not an easy question to answer, which is why I have consulted with a law firm to get the answers. So you must record a COVID-19 illness on your OSHA Form 300. So for those of you that don't know what an OSHA Form 300 is, this is a log that each employer must keep to record your workplace injuries or illnesses throughout the year. So you must record the COVID-19 illness as a work-related injury if it's a confirmed case as defined by the CDC, if the case is work-related, and if the case involves one or more of the general recording criteria. And OSHA will consider your employer's investigation when they're looking at it. So each time you have a COVID case in the workplace, OSHA says you must investigate that to determine whether it came from the company or not. So you need to ask the employee how he or she believes they contracted it. And while respecting their privacy, you need to discuss their activities outside of the workplace that may have led to it, and review the employee's work environment for potential exposure. All right. So COVID is likely work-related if there's multiple cases that develop among workers who work closely together, or contracted shortly after lengthy close exposure to particular customer or coworker who has a confirmed case, or the worker's job duties include having frequent close exposure and the general public in locality with ongoing community transmission. And so all of the above, if it's all of the above, then there's no alternative reason. It's generally going to be work-related. If it's work-related, you need to contact your work comp provider and talk to them about, if you need to report the claim. It's likely not work-related if the employee is the only one who got it in the vicinity, right? And if they don't have frequent contact with the public. If the employee closely and frequently associates with someone outside of the workplace who has COVID. So those are two reasons that it's likely not work-related. And you do not need to record it as an injury if you cannot determine whether it's more likely than not that the exposure in the workplace played a causal role.
Period. The farmers' policies used to include all names on the cards, period.
We just got somebody speaking. I'll take care of that. Keep going, Kelly. Kelsey.
Okay. So there are a couple instances where you must call OSHA right away. So if an employee is hospitalized or dies of COVID, then you, if there's a passing of an employee, you need to report that to OSHA within 8 hours. That's if it's work-related, okay? And if they're hospitalized, then you have to report it to OSHA within 24 hours. And you have to actually call OSHA and tell them that this has happened. This is if it's a work-related, if you've determined that the case is work-related. And so you would do the same thing to call OSHA. You would determine the work-relatedness the same way that you would determine it, as I said previously. Okay, so it's not a different determination. So last but not least, you want to check your state and local laws. So Georgia doesn't have anything in particular with just reporting general, COVID cases from employees. But if you have employees or you have, people that that have companies in different states, you should let them know this. Here's an example. So New Mexico requires employers to report to New Mexico OSHA any case in which an employee tests positive for coronavirus within 4 hours of the employer learning about it. It does not need to be work-related. So that's what is different here, is they're saying if you have an employee who has COVID, we don't care how they got it, we have to know within 4 hours. And so, I haven't seen other states with this same requirement yet, but this is an example of a more severe requirement than we've seen in other states. Any questions?
Kelsey, if you can, as we let people think through what kind of questions they've got for you, enforcement seems to be the most sensitive one about telling people to do certain things. Any feedback on how to coach people towards enforcement?
So, you know, it really needs to come from the top down. I mean, if your leadership, or if you as the owner or, you know, the partner of the company, don't feel strongly about the wearing the face mask or, you know, following the recommendations, then your employees are not going to care either. And if you enforce it on them and then you're, you know, kind of walking around not caring about it, that is going to send them a really negative message. So I would say you have to decide what you want to do as a business owner, and then the policies need to align with what you're willing to enforce. And then you have to be ready to enforce it. And when I say that, I say you've got to be ready. Are you okay with terminating someone for violating this? And if your answer is no, then we need to rethink your policy.
Okay. Questions from other people?
Kelsey, I have a question. I have a friend out of state who is being required to go back to work, and she is not comfortable with that, but they basically said, you show up or you give up your job. Are there any resources that you would recommend I share with her so she can, I don't know, have a position that doesn't make her lose her job?
Yeah, so they can do that. I mean, unfortunately, they can. She can say, I'm uncomfortable coming into the office, and you know, and they can say, if you don't show up, we're recalling you back, and if you don't show up, you've lost your position. And one way that she could be protected of that is if she has a health condition that is high risk, that would be her reason for not being able to return. And that would possibly provide her with some sort of protection where she's saying, look, it's not just because I feel uncomfortable about this, but there's actually a reason why I'm high risk, or, you know, or maybe if
Kelsey,
the employer is,
would the ADA help if she has a documented disability?
Yes, if she had some sort of, but it would need to be, it would need to be, her doctor would need to write her out saying, you cannot return to the office due to this high risk condition or high risk disability. But even then, the employer could say, I don't care, we're terminating you. And especially if they're under 15 employees. So 15 employees is what triggers ADA and in Georgia. And if they're under 15 employees, they don't even have to comply with ADA.
All right, we've got time for one more question. Enforcement seems to be the one that's hard. Involves HR people, you know, really understanding people. So does anybody else have any last question for Kelsey?
Yeah, I think it's just, I mean, if nobody has questions, I really think the enforcement piece is, you know, the policy needs to be very clear on what the expectations are and what the consequences are. The company leadership has to be willing to move forward with the consequences that they've written in policy, and then employees need to be trained on that, so and sign off and acknowledge that they understand if they violate these rules, that, you know, what could potentially happen.
All right.
I have a question, Kelsey, real quick one. Is there
Sure.
some way, given all the circumstances, is there some type of online type of learning or tutorials or something that's offered that's useful for everyone in Georgia, or is that not something that's available yet?
You know what? I have seen a number of short videos. What I'm going to do is I will send over the link that has the videos on the short. It has it on different topics, and I'll send that over to Hal and Jared. And then, are you guys able to get that out to everyone? Okay.
Yep.
Cool. Yeah, I'll do that.
Okay. Thanks.
Okay. All right. In wrapping up then, again, Kelsey, thanks so much for the conversation. It's obviously on our minds, or in some cases needs to be on people's minds. As a wrap up, you know that we like to have a little bit of humor in what we're doing. So, and I think JD would probably go along with as well as treat your employees right. So they're not on Twitter. Next week is Monday is a holiday, so we will not be participating, and we will be announcing our September, October schedule of speakers. I think last week I mentioned we're working with the networking group, Atlanta Business Growth Team, and we've got a whole bunch of people who are trying to juggle who goes where. So we have a September schedule. So Kelsey, thanks again. Anybody need to reach out to Kelsey, you're always welcome to with this. And with that, we're going to call it a day. Thanks, everybody.
Thank you, guys.
Thank you.
Thank you, Kelsey.
Bye.
Thank you.
Kelsey.
Thanks.